Hi, my name is Giselle Dunstan, and my research is on the discrimination against the trans community. What's the problem? Trans youth are excluded from making decisions regarding their own body, in medically transitioning and just within learning about who they are and what they want to do in life. Transgender people have more difficult time accessing basic human commodities compared to cisgendered people, and trans individuals are more often harassed or physically and sexually assaulted because they are trans. Trans youth in education. My research question was, should transgender youth be allowed to play with the gender they identify with, or assigned at birth? So, trans youth students are more than twice as likely to be bullied in school compared to cisgendered students. And not only that, but trans students are banned in some states from playing on the school teams they identify with, meaning that a trans girl could not play on the girls' sports teams for her school. She would have to play on the boys' sports teams if she wanted to play on teams. So that not only outs her, but it just brings an uncomfortable sort of position against her where she would have to play with boys instead of girls when she is a girl. So, my research question for this topic was, should minors be allowed to medically transition? So, in some states, medically transitioning when you are under the age of 16 is illegal, regardless of parental consent. And medically transitioning could include hormone blockers, gender affirming surgeries, or facial surgeries, meaning getting or receiving plastic surgery to look more like the gender you identify with. What is the purpose of this research? Is to educate others on the effects of this discrimination and what effects those have on trans students and minors. It shows the effects of mental health from trans students, and it's what is happening based on the bans and discrimination they face. The bathroom bill is a bill that was placed against trans adults from using the bathroom that they identify with, meaning a trans man could not use the men's bathroom, he would have to use the women's bathroom. So, it causes more violence towards the trans community by outing them, and it brings more attention towards them where they could face sexual or physical harassment. The purpose of this research was to show the effects of the ban placed against trans individuals and how they can do more harm than good. The ban is said to prevent violence against women, but it in fact causes more violence against trans people. So it was placed to protect trans women from quote unquote dangerous trans women, but it's not true. It in fact causes more violence towards the trans community. Um, Trans adults have twice as many poor mental health days compared to their cisgendered people, and trans adults are 4 times as likely to attempt suicide compared to cisgendered adults, meaning trans adults face many more mental health issues. And that's not saying that not everybody doesn't face mental health issues. It's just saying trans adults are more likely to suffer through this. It's the purpose of this research is to educate others on the effects of discrimination against trans individuals and how it is damaging to their mental health. Nearly half of trans adults reported having a negative experience with a healthcare provider because they have to out themselves or whether they are asked inappropriate questions based on their gender identity. And 1 in 3 trans adults experience homelessness in their lifetime. Most trans adults make less than 25,000 a year, which is not enough to even rent out a building, let alone purchase food or have a sustainable income. The purpose of this research is to educate others on the effects of discrimination against trans identifying individuals in everyday life.